Hey teams, Lauren here with Bizrok. In today's video, we're going to talk about one of my favorite concepts, and that's this concept of trigger words versus power words. Now, for those of you that haven't done training with us, you might be thinking, okay, what's a trigger word? And power word sounds pretty positive, but okay, Lauren, what are those things? Let's start with trigger words. So trigger words are the words that you want to avoid because they'll trigger an emotion to your patients that we don't want. It might be triggering a negative emotion or feelings of fear or anxiety because they're at the dental office. And so trigger words tend to be negative words, but most importantly, they're the words that we always want to avoid when communicating with our patients. Power words, on the flip side, those are the positive words. Those are the replacement words to really make our patients walk away feeling special. I'm sure you've heard it from us at some point in time. People only remember about 7 to 10% of everything that you say, but they remember 100% of how you make them feel. And so replacing those trigger words, those negative words, which we're going to talk about some examples, but replacing those trigger words with a power word is a really special way to create that positive feeling of emotion with your patients. So let's dive into a few examples, shall we? A negative or a trigger word are words like no, or don't, or won't, or can't. Nobody wants to be told no. Your patients certainly don't want to hear, oh yeah, we can't see you until. You can have a positive spin on the fact that your practice is really busy. So instead of saying, no, we can't see you, you might say, our doctor's schedule is really busy. However, we happen to have an opening on this day at this time. We also, if we have a shift in our schedule, we'd love to personally give you a call. See, it's a more positive conversation there versus just saying, oh, no, I'm sorry, we can't see you today. And so it's a small twist in your verbiage. Some other words that you want to avoid is the word emergency. Emergency, guys. I know that sometimes our patients will say, I'm calling because I've got a tooth emergency or I'm in a lot of pain, and they're using those words, but we don't want to prompt those words. So sometimes I hear practices say over the phone, they'll say, are you calling for a routine visit or cleaning, or are you calling for an emergency? Okay, well, how can we replace that? How can we have a more positive conversation with our patients? What we might say is, are you calling for your routine cleaning, or are you calling about something specific? See, that small twist, that small change in verbiage, just swapping one bad word for a more positive word creates a more positive conversation with your patient. Another few words that you want to avoid are pain or anxiety or anxious. Nobody wants to hear somebody say, well, are you in a lot of pain? Let the patient say that they're in a lot of pain. Let the patient say that they're anxious. So you want to create that positive experience with your patient, but you really want to do that on the phone too. So avoid those words, avoid pain, avoid anxious. Talk about what you do provide in your office. Another few words when it comes to trigger words are top and bottom. Guys, we could have so many jokes and talk about, top and bottom with regards to our own body. But when it comes to a patient's mouth, to their oral health, it really should be called upper and lower. It's the proper terminology. Plus, it sounds a little bit more professional. So I always plug in top and bottom into a trigger category versus upper and lower is the proper verbiage whenever we're communicating with our patients about their overall oral health. So those are great replacement words too. Last couple trigger words, guys, we could be here all day talking about these, but one of my most cringeworthy words is the word cancellation. I know that you guys actually have cancellations occasionally in your office, but we never want to put that word into our patient's mind, because if we talk about cancellations, then we're telling patients that patients do cancel here sometimes, and you're allowed to also. So we don't want to create that bad habit. Instead, we might say there happens to be an opening, or we had a shift in our schedule. Replacement phrases such as those will allow you to have a more positive conversation without sharing that you've had cancellations in your office. I would put no-show in there too. Like, we don't have no-shows. As far as our patients are concerned, we don't use those words, right? Last couple ones is the phrase, I don't know, or I think. Let's dive into both, shall we? So the phrase, I don't know. I know sometimes you guys don't know all of the answers to everything a patient could ever ask of you, but instead of saying, I don't know, maybe you build up the authority of somebody in your office who does know. Maybe you're a rock star clinician who you heard the phone ringing and you saw how busy your front office team was. So you go up front to help them and you answer the phone and they start picking your brain and asking you all these insurance questions. And you're like, Lord, I really don't know. I really don't know the answers to these. Guys, that's okay. Build up the authority for your insurance coordinator. You might say, so if they're asking you all these insurance questions, you might say, you know what, thank you so much for asking that. That's such a great question. Katie is actually our insurance expert in our office. I'd really like to verify some of this with her. She's assisting another patient at the moment. Would it be okay if I spoke with Katie and either she or I could personally give you a call back? Now, your patient doesn't know that you don't know, but you also sound really professional. You feel your patient's going to feel like you care, you know what you're talking about, but most importantly, they're going to leave that call feeling confident that Katie or someone like Katie will give them the right answer. And so avoid the phrase of I don't know. Don't talk about what you don't know. Talk about the authority in the practice or a fellow team member who would know. And then the last phrase that I want to talk about is this concept of I think. Guys, I know that sometimes in life we're told to not tell patients what to do, and we'll say, I think you should do this. My doctors, I love my doctors, but sometimes they fall trapped to this too because they don't want to feel like they're selling their patient. Here's what I would tell you. If you are the expert in the room and you know exactly what your patient should do, tell them. It's also okay to say things like, if you were my mother, I would recommend this. If you were my child, this is how I would handle this. Instead of, I think we should do this. When you say phrases like, I think, it creates this illusion that you're not confident. Guys, I know you're confident. I know you know exactly what to say and exactly how to treatment plan and serve your patients. Tell them what to do. They're going to hear that confidence and they're going to take that confidence and move forward because they're going to say, this doctor, this hygienist, this assistant, this front office financial coordinator, they know exactly what to do and I trust them. And so they know the best thing for me. So that's what I'm going to do. So hopefully some of those examples create that confidence of, okay, Lauren, I'm going to avoid some of these trigger words, but how do I replace them? What are some other great ways to replace these verbs, or excuse me, this verbiage? So power words, remember I said these are powerful, positive words. You might use words like customized. So imagine how your patients would feel, because I know how you guys are, and I know that you treatment plan your patients and you create custom treatment plans just for them, right? Brag on it. So whenever you're speaking to a patient, say, Susie patient, we're going to create a customized experience just for you. We're going to make sure that you walk away with a customized treatment plan that you feel comfortable with. That's a really powerful word to make your patients feel heard and taken care of, but also so they walk away not feeling just like a number. Nobody wants to feel like a number. You guys don't. Your patients don't either. And so customize is a really great replacement word. Another great word, this is one of my favorite words, is personally. So imagine you and I are having a conversation, and imagine I say, yeah, I'll get back to you, versus if I say, I will personally get back to you later on today. Which of those examples creates more confidence that I will get back to you? Clearly the second one, right? When I say I will personally do something, it creates a lot more weight. There's a lot more weight behind that phrase, and it creates that confidence for your patients. So, saying personally, even if you're passing it to a team member, maybe you say, oh gosh, this patient's asking me about all these insurance questions or financial arrangements for their treatment plan, and I don't know. We don't say I don't know now, remember? So you can say, you know what? Catherine in our office is actually our financial expert, and she's assisting another patient right now. I'm going to personally speak with her this afternoon, and either she or I will get back to you. Would that be okay? Guys, your patients, they're going to say yes. Of course it's okay. They want the expert. They want to personally speak to the expert. And so by you saying that, by you switching that negative word with the positive one and saying, I'll personally do this, they're going to feel taken care of. It just creates that extra level of trust and commitment from you to make sure something gets done. If you've worked with Bizrok at all for any period of time, you know one of our personal favorite words is the word exceptional. Guys, I love this word. You can have a good experience or you can have an exceptional experience. I don't know about you, but I want an exceptional life. I don't want just an average or a good or an okay life. I want an exceptional life. I also want an exceptional experience, and I want my patients to have an exceptional experience. So maybe talk up your office for a new patient, especially when a new patient comes in the door. Tell them, say, you are in the right place. We provide our patients with an exceptional experience. So I know that you're going to walk around and walk out of here knowing that you have the right dental practice to serve your needs. Guys, your patients are going to be like, wow, I've never had this before. We're going to go through a few more words today. So hopefully you're taking notes and you're jotting these down. Change is a trigger word. So we don't like to make changes. You guys don't like whenever we make changes. So what is a replacement word? A great power word for this is the word enhance. The word enhance, if you have a second, I would look it up, but the word enhance means to add to. And so it doesn't take away from your patients. So you might say things like, is there anything about your smile you wish to enhance? It's a really powerful question that won't offend somebody. What might offend a patient is if you say, is there anything about your smile you wish to change? They might be like, I don't think so. Do I need to change anything about my smile? And so they start getting a little more self-conscious, questioning if, well, gosh, did you see something? Should I change something about my smile? Versus enhance is an opening line. It's an opening question to start to get to know your patient's goals and overall oral health, wants, and needs very early on in the relationship without offending them and saying that they need to change something. So I would replace the word change with enhance. Last couple ones that I'd love to share with you guys is the phrase, my pleasure. Now, maybe you've been to Chick-fil-A or the Ritz-Carlton and you've heard individuals, their team, use this phrase. Well, let me ask you this. Why would they use my pleasure versus a no problem, no worries, or you're welcome? Well, if you were paying attention when we talked about trigger words, no problem and no worries, those are negative phrases to say. There, no is a negative, worries and problem, those are also negative words. So why do we use them? Sometimes it's a bad habit. So it's like, okay, well, how do I replace that word? What about you're welcome, Lauren? Well, whenever you tell someone you're welcome, you're inferring you're welcome, I did this for you. Versus when you say my pleasure, you're saying it's my pleasure, I got to do something for you. How do you think that's going to make your patients feel? Very special, right? And sometimes I'll have team members say, well, gosh, Lauren, what if, I use this phrase, my pleasure, and people are like, you guys are like the Chick-fil-A of dentistry. Great. What an amazing compliment. Who wouldn't want to be compared to them? Guys, that's amazing. So it's okay. So don't get in your head about, I can't say my pleasure because people are going to call us this. That's okay. People like that extra level of service. It makes them feel special. So I would focus on replacing you're welcome, no problem, no worries with my pleasure, because it is our pleasure. Guys, it is our pleasure. We get to do what we do in our practice, that we get to serve the patients who come in and see us or call us. And so here's the other thing I'll say about my pleasure. If you start using that verbiage, that phrase of my pleasure over and over and over again, you'll actually train yourself to think it is your pleasure that you get to serve your patients. It's a change in philosophy to truly just serve your patients, but also your fellow team members. So I would try that one. I would give it a go. We've talked about a lot of different trigger words and power words, but that's one of my favorite phrases. And it creates just this really special bond with your patients, but also when you're with your team members, when you say, oh, it's my pleasure. It truly is my pleasure to serve you. So that's the purpose of the phrase. Last thing that I'm going to wrap up with you guys today, because this impacts you. You guys are a team. You work together every single day. You serve patients together. Sometimes you spend more time with each other than you do your own family. One of my pet peeves, I will call it, is avoiding the words of staff, employees, or the worst one is probably human capital. I remember I heard somebody years ago, he referred to people as human capital. Guys, I don't know about you, but I don't want to sound like a number. And when it comes to staff, let's be honest, guys, staff is an infection. You guys aren't an infection, you're a team. And then employees, again, I don't know about you guys, but the word employee doesn't sound exciting. It doesn't sound cohesive. But whenever you refer to each other as your fellow team members, guys, it means something more. It means that you are on the same page, you are on the same team. And I'm telling you, if you switch out that verbiage, you're going to treat each other differently. You might actually start treating each other like a team. So hopefully you enjoyed our time together today. Reach out if you're struggling or if you need some additional guidance on how to replace specific words in your practice. But otherwise, we can't wait to see you and serve you soon.